How do sensory nerves relate to TB peripheral neuropathy? Have you ever wondered how sensory nerves play a role in peripheral neuropathy for those with tuberculosis? Let's dive into this important topic. Peripheral neuropathy in tuberculosis primarily involves damage to sensory nerves. These nerves are crucial because they transmit sensory information, such as pain, temperature, and touch, from different parts of the body to the brain and spinal cord. In patients with tuberculosis, peripheral neuropathy often shows up as symptoms like numbness, tingling, burning sensations, and loss of sensation, especially in the lower limbs. The connection between sensory nerves and tuberculosis peripheral neuropathy comes from two main factors. First, tuberculosis itself and related conditions can harm sensory nerves. For instance, malnutrition, particularly vitamin B deficiencies, HIV co-infection, diabetes, and other metabolic issues can lead to nerve damage. This damage disrupts the nerve's ability to send sensory signals, resulting in neuropathic symptoms. Additionally, enlarged lymph nodes or inflammation due to tuberculosis can compress peripheral nerves, leading to localized sensory deficits. Second, the side effects of anti-tubercular drugs can also contribute to peripheral neuropathy. Certain medications used to treat tuberculosis, such as isoniazid, ethambutol, linezolid, cycloserine, and paraminazalicylic acid, have been known to cause nerve damage. This drug-induced neuropathy mainly affects sensory nerves, leading to symptoms like numbness, tingling, and pain. For example, linezolid can harm neurons and the myelin sheath, which is the protective covering of nerves. This impairment can disrupt sensory nerve function and may even be irreversible after stopping the medication. The mechanism behind sensory nerve damage in tuberculosis peripheral neuropathy involves injury to the nerve fibers or their myelin sheaths. This injury disrupts normal nerve signal transmission. In the case of linezolid-induced neuropathy, impaired autophagy in Schwann cells, which produce myelin, contributes to myelin loss and sensory nerve dysfunction. Clinically, sensory peripheral neuropathy in tuberculosis patients presents a mix of positive symptoms, like pain and tingling, and negative symptoms, such as numbness and loss of sensation, primarily affecting the lower limbs. Electrophysiological studies can often confirm sensory nerve involvement. In summary, sensory nerves are central to tuberculosis peripheral neuropathy. The condition arises from damage either directly from tuberculosis-related factors or indirectly through the neurotoxic effects of anti-tuberculosis drugs. This damage leads to impaired sensory signal transmission, causing the characteristic symptoms of peripheral neuropathy seen in tuberculosis patients. It is crucial to monitor and manage these sensory nerve complications during tuberculosis treatment to minimize long-term disability. Always consult healthcare professionals for personalized medical advice and management strategies.